I'm curious also about physical activity. Let's talk about that just a little bit. When kids enter middle school, typically recess is cut off, we know, and the workload increases substantially. Just as an example, I was visiting with my little niece yesterday, and she said, I really want to go for a walk, but can't because I have X number of exams or so much homework, and that seems to be a typical day for a child. It's pretty burdensome. Do you think schools have a role to play in balancing things a little better with respect to increasing physical activity levels and perhaps reducing workload a little bit? I wonder if it is because of the emphasis on competitive testing that goes on in the future, that the children are under a tremendous amount of pressure nowadays.
Yeah. Physical activity clearly plays an important role. Not only does it reduce the likelihood of obesity, but if a child's already overweight or obese, it reduces many of the risk factors associated with obesity.
Right.
And it's true that we've engineered physical activity out of children's days. We've made it easier for them to be sedentary. Fewer children walk to school. More children are driven by buses or even in their cars. And in many cases, that's a safety issue. I mean, when I still lived in Boston, I had parents in my clinic who were driving their children 3 blocks to school because they were worried about the child's safety if the child walked to school. Now, one of the things that has engineered physical activity out of schools is the emphasis on academic performance. But there's a growing body of literature, in fact, a paper that, a summary study that was published by the Division of Adolescent and School Health here, demonstrated that the overwhelming majority of studies showed that physical activity improved classroom behavior and improved academic performance. So your niece may have been able to study more effectively if she had been physically active. And that's the case that I think we have to make in schools. One of the most important strategies that we think schools need to employ is quality physical education. That schools are a safe place for children to be physically active. Schools do have the facilities to support activity. But what they don't have, many schools, are physical education instructors or teachers who can keep kids active for most of the time that they're in physical education programs. So that these are programs that have children moving 50% of the time rather than the current 20% of the time that children are likely to move.
So do you think there are research or other initiatives moving in that direction that are really helping schools, you know, increase activity levels for kids?
Well, I think the case has to be made, and teachers need to understand, well, let me rephrase that. Teachers understand that connection.
Right.
But what
the larger
structure does not. And, so if you talk to teachers, as we have, teachers will say, oh yes, we know that physical education, we know that physical activity helps children learn. So one of the things that, another strategy that they're using are activity breaks in the classroom. So when they feel like the class is
getting too fidgety.
To get them up, move around for 5 to 10 minutes, and then sit back down, and they're able to study.
Now, I know this may be purely speculative, but there has been a high, rate of increase in conditions such as ADD, especially for young men, young boys. I'm curious, do you feel that that may be related to long periods of sedentary activity? And kids are already, walking around with gadgets nowadays, and there is not a natural sociality to life as there once used to be. Do you think that may have something to do with the high rates of ADD that we are observing? I mean, we have seen that just grow astronomically.
I personally believe that's the case. There are not a lot of data which confirm that, but we do know that in the treatment of ADHD, outdoor play, physical activity enhances the ability of children with ADD to concentrate. So I'm prepared to believe that it's
I guess there's
causal.
a surplus of energy that sometimes needs to be used up. Tell us a little bit about CDC's Lean Works initiative, and how did that come about? I take it this is an obesity prevention initiative for the workplace.
So 7 or 8 years ago, my division embarked on strategies that would help employers address obesity. And we began here at CDC with CDC as a work site and put in things like lactation rooms for breastfeeding mothers or physical activity centers, or we eliminated tobacco use on all the CDC campuses. We started garden markets. We made our campuses more walkable. And that led us to conversations with larger businesses about implementing those same strategies. And that's a pretty easy case to make. The large employers understand that. And we are a large employer. But that doesn't really help the small to medium-sized employer who is in a community, may or may not pay their workers' insurance, probably doesn't have a cafeteria, may not have the capacity to have a room where mothers can breastfeed after they come back to work. So we developed this tool called LeanWorks, which is directed to small to medium-sized businesses that would help them think about how to institute strategies to improve the health of their employees. Now we're given the fact that we are now in a situation where we're funding a number of communities and states under the Recovery and Stimulus Act in a program known as Communities Putting Prevention to Work. Many of those communities are beginning to change in a way that supports better nutrition and physical activity. And now our efforts are going to be to tie those small businesses and medium-sized businesses to these community initiatives from which they will benefit as well as the rest of the communities.
So a program such as this one, is it primarily an online program?
LeanWorks is
okay, so it is not the case
online.
That someone goes on site and coaches?
No.
Okay.
No.
I see. So it's entirely online.
Correct.
All right. What would be a sort of a summary message you might give to the average mother or father out there with respect to how they might proactively deal with this massive epidemic that we are dealing with?
Well, the 6 strategies that we talked about, and I think all parents need to think about, are physical activity. New mothers should breastfeed their children, and the longer they breastfeed them, the more protective that impact will be. To promote fruit and vegetable intake, to go to their local farmers markets, to try to buy locally, to, if there's not a supermarket, push for change. There's $400 million in the 2011 budget to build supermarkets in underserved areas. To eliminate sugar-sweetened beverages from the house. The average child's intake of sugar-sweetened beverages accounts for about 250 calories a day, and that's an easy target to substitute water for sugar-sweetened beverages. To monitor and not use fast food or high-calorie snacks frequently, to make snacks, fruits and vegetables, rather than higher calorie
more energy-dense foods.
And finally, to control television time. And one of the most important things they can do to control television time is to keep televisions out of children's rooms, because 30% of 2-year-olds, and 30% of 3-year-olds, and almost 70% of all children have a television in their room.
Television serves as the babysitter for most
homes. It is, and those children are watching more television, and we know that there's a direct relationship between television viewing and obesity.
Well, I'd like to just follow one question with respect to this, and because obesity and overweight is so common, a lot of parents are beginning to get concerned about research, universities coming into schools and schools being research grounds. I'd just like to address that very, very briefly with respect to what is the way out of that. I mean, we do need to do some level of research so we know what's going on, and to also sometimes as an early detection to let parents know that there may be a problem. Any thoughts on how we might deal with that?
We do need to understand what the impact is of the programs that we're implementing. That's just
has to be
quality
done.
assurance, right? If we're going to hold ourselves accountable, we have to know what works. These are not really about research or using children as guinea pigs, but rather understanding whether what we're doing has a positive benefit. So I prefer to talk about this as evaluation of the impact of our programs. It's not at all about research, which is disconnected from the future of our children.
And a final word, if any, for universities, and in terms of research, where are we headed, or where should we be headed?
Well, I think there are extraordinary opportunities to understand how to change the direction of this ship. But the traditional modes of research are probably not as applicable here as understanding more the community impact of what we're doing and what kinds of policies work, and how we strategically link the child care centers with medical settings, schools, and communities in order to provide an integrated approach around these 6 behaviors that I've mentioned earlier.
Well, that's been very useful to know, because I think it gives people something to hold on to, like a roadmap to work with. And I think it addresses both nutritional and behavioral factors. So,
great.
Dr. Dietz, I thank you. That was very, very helpful.
Well,
and
pleasure
thank you for
talking to
joining
you.
us.
Sure.